Hey parents, my name is Dr. Chris Boman. Thank you so much for joining me on this webinar about reflux, colic, and constipation. I really hope your kid isn't dealing with it and you're just trying to prevent those things from coming, but the truth is most likely you're watching this because your child has one of those issues and we're trying to figure out what to do. Maybe you don't want to put your kid on medication. Maybe the doctor's told you that there's nothing else that you can do. Maybe you've tried the medication and it doesn't work. Or maybe you're just simply trying to understand, why is my kid like this? My friend's baby, my first baby, my next baby, or whatever, it wasn't like this. What's going on? I want to know more. And that's what this information, or that's what this webinar is all about. How can you understand what's going on within your baby so that way you can make the most educated decision on either how to treat, prevent, or help the baby work through the issues that they are dealing with. I'm a pediatric and prenatal chiropractor, certified as a diplomate by the ICPA. It's the International Pediatric Chiropractic Association. It's the largest certifying agency around the world. There's tons and tons of docs that go through this program, and so we are always updating. We're always getting the top research, the top educators to come in and teach us. It gives me that extra layer of understanding of what's going on with these kids, so that way I can help you get them better as quickly, efficiently, and safely as possible. Now, it might seem weird, why are you combining reflux and constipation and all this in one seminar? Aren't they all different symptoms? And the answer is yes. But what I want to do is kind of tie them all together for you, because there is one system that, if we don't look at, could cause or be the root cause behind those three things that we talked about. When you're looking for treatment or you're looking for help with these things, typically the first course of action is parents will go to a pediatrician. Now, the pediatrician, like I said before, might tell you it's they'll grow out of it, or this and that and the other thing. The first thing that I really want to help you and encourage you in is that you need to trust your gut. If they say you need to grow out of it, so everything's okay, this is normal, you need to trust your gut, and you need to go with, if this doesn't feel normal to you, know that that's okay to feel that way. And you can seek out other opinions. Facebook is a huge resource, but you can seek out other people that might know a little bit more, or might be a little bit more interested in what's going on behind the scenes. Because the truth is, common is not normal. Just because everybody's experienced constipation, everybody's experienced reflux, or all your friends' kids are, it doesn't mean it's normal, okay? Uncomfortable, stressed babies are not normal, no matter how common it is. And our baby struggled with constipation a little bit when we transitioned from breastfeeding to eating solids. And I remember her sweating and screaming, trying to get that bowel movement out. I've had lots of babies where they're throwing up, 5-6 times a day every time they feed. And that means laundry 5 or 6 times a day for you and the baby. I understand that it doesn't smell good in the car seat. I understand that you can't you feel uncomfortable letting other people hold your baby because you're afraid they might throw up on them. And then I understand what it's like when your baby is crying 3 to 4 hours a day for 3 times a day, or 3 times a week, or whatever it is. If your baby is experiencing colic, we don't just want to wait till they grow out of it, because it causes a lot of emotional stress, psychological distress in you, in the siblings, but also in the baby. And so we need to figure out what's going on at its root so that we can make better choices to take care of our babies. And now, we talked about colic, reflux, and constipation are all linked, okay? And they're linked by, we call it the golden thread, okay? Even though you have different systems like the digestive system, the lower digestive system, the upper digestive system, different systems that might be involved in that specific symptom, the common thread is actually the nervous system, okay? And if you don't know what the nervous system is, it's the sensory processing information. Let me show you with our spine here. It's a sensory processing system that is designed to take in information from the outside environment, give it to the brain, and the brain is in charge of processing the information and sending information down through your spinal cord so that your baby and yourself properly adapt. Now, when this information communication system gets distorted, gets interfered with, it causes the body to go into a state of stress, okay? We're gonna talk about what the sources of stress might be, or what the causes of that might be, but I bet you're saying now, why didn't anyone tell me this sooner? Why am I focusing on Zantac, or why am I focusing on Miralax, or sometimes even neurodepressant psychiatric medications for my baby, when I'm not even addressing the root cause? You're addressing the symptoms and not the root cause. Why didn't anybody tell me that the nervous system was involved in these three things, okay? I just kind of want to walk you through what stress looks like. When the nervous system is stressed, like I mentioned earlier, what signs or symptoms there might be, and how you can see that you might have colic when you're little and grow out of that, but into reflux, and out of reflux and into constipation and other things. So at 2 weeks, some people notice that their baby is really, really stiff and they're lifting their head right away. They're not a nice, loose, relaxed baby. That's a sign of stress. At 4 weeks, they're straining, and usually there's nursing issues indicating that there's stress in that baby. From 6 to 8 weeks, that's where we start to get that spinning up, uncomfortable, arching baby, not wanting to latch on one side or the other. And that starts to get into in 3 to 4 months, where you have colic and sleep regression, leading to 4+ months where the baby is just constantly fussy. The baby gets constipated, the baby is still really, really tense, and then moving on even further, 5 to 7 months, where you start to have torticollis, which is where the baby can't turn their head one way or the other, and plagiocephaly, which means that we have flattening in the cranium. You can see how the problem never really went away. It just kind of morphed and creeped its way into a different system. So it's really, really important that we address the root cause so that each and every system doesn't get infiltrated, because you can see it goes from the musculoskeletal system, lifting the head and tension, into nursing issues, so the digestive system, into more of the musculoskeletal system, the way it starts to develop. Now, when we're looking at the neurology of stress patterns, okay, so reflux is the first stage of digestion. You might have some gurgling or spitting up. Colic is defined as 3 hours of crying a day for 3 weeks. Which is also like having specific times that they're crying, such as witching hours. And then constipation, you guys kind of know, it's gassy, fussiness, and infrequent bowels. I've had people, little babies come in where they haven't had a bowel movement for 3, 4, 5 days, and the pediatricians are saying that's normal. Okay, it might be common, but it's definitely not normal biology and neurology to not have a bowel movement, for babies, a couple of times a day to at least once a day. Now, how I like to describe how the neurology gets stressed, we talk about that common thread that's linking the digestive system, the immune system, and the upper respiratory and all that stuff together. I like to use the analogy of the gas and brake system, okay? Because we all drive a car, we all kind of know what that is. The gas pedal is obviously what makes the car go. In the bodies, we're gonna think of that as our stress system. When the gas pedal is on, the body is in a state of stress, survival, in order to protect itself. And then we have the brake pedal, which is our rest, grow, and neurodevelopment stages. It allows our body to have better steering, better control of itself, and allow for optimal adaptability, growing, and development. So when we're talking about what causes the body to be in a chronic state of stress, or the gas pedal, we say it comes from 3 main sources. We have physical, we have chemical, and we have emotional. And we're gonna go through those in a second, how the baby might be exposed to each and every one of them. But if we have an overload of stress, that's what's gonna trip the wire or cause the body to be in a constant state of stress. Which, when the body's in a constant state of stress, it's not in that neurodevelopment, digestive, relaxation mode. And that could be one of the reasons why those systems aren't working the way they're supposed to. So the first one, we talk about a physical trauma. When the birth process itself is super, super stressful. It's one of the most stressful things that a baby will probably ever go through, because you're fitting through a very tiny hole, you're being squeezed. And then if you don't have a vaginal birth, a cesarean birth is even more stressful. A lot of times they use a vacuum to pull the baby out. Sometimes in a vaginal birth, they use forceps or even a vacuum to take the baby out. That's a lot of stress right at the upper cervical spine. And then if the baby was in a suboptimal position, such as a breech position or a transverse position, especially when the mom is in contractions, that could definitely put stress on the neck or in the lower back. And then also, when we start to look at lip ties and tongue ties, getting those revised is also a physical trauma. The second source of stress that we talked about is chemical stress, okay? Now, you may be talking about the baby isn't necessarily exposed to the outside world. How can they have chemical stresses inside them? Well, the study out of Quebec, Canada, that tested the cord blood and found things like glyphosate, Bt toxin, which are genetically modified, in things like genetically modified foods. They found carcinogens. They found all sorts of things that were already present in the cord blood. So especially if you live in a, an area where there's lots of pollution, or you're not careful with your diet, drinking poor water, or breathing in polluted air, it's possible that your baby, before they even get exposed to the outside world, is already exposed to outside toxins, and that's why they might have had chemical stress from early development all the way through. And then the last one is emotional stress. We talked about this again a little bit in our prenatal postpartum webinar, but a lot of times ladies, especially right here in Southern California, When they're pregnant, they are go, 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 especially my nurses that are lifting things that they're not supposed to, that are working 24-hour shifts, that are always on their feet. And so if the mom is emotionally stressed throughout the pregnancy, that's going to give off stress hormones that the baby is reading. And then even in postpartum, if the mom continues to be stressed, that actually changes the makeup of the breast milk, where the breast milk is going to have a little bit more of a stress flavor or a tinge to it, which tells the baby to stay in that chronic state of fight or flight and stress, which is going to change neural development and possibly delay it. It's going to change the way the digestive system is moving food throughout its system. It's going to change the way the baby is absorbing food. It could change the way the baby is latching. Maybe they're getting a little bit more air, and that's why they might have reflux or colicky, gassy bubbles. Present with constipation. So when we're looking at taking care of these babies, and especially adjusting babies, first of all, I want you to know that adjustments are very, very safe. They're actually pretty anticlimactic when you watch it being done, where we're just a small touch on the upper cervical spine right up in here, or a small touch on the sacrum or tailbone, and it's actually enough to stimulate this rest, relax, and neural develop system, because when the baby is stressed, it's just a little bit of energy that we need to go ahead and relax when we do it in the right spot, at the right time, at the right place. There's other things that you can do, such as changing up your diet. There's other things that you can do, like prayer and meditation, things that really help calm your body down so that the baby is getting less stressed. Breast milk, sleep is really, really, really important for you. So if your baby is not sleeping, getting the adjusted actually helps, like I said, stimulate that parasympathetic relax digest mode, which means that oftentimes they take longer naps or they sleep deeper. And the adjustments also provide for less tension and increase in the comfort level of the baby. Know that you're not alone. Know that you're not the only mom to experience a baby with colic, reflux, or constipation. So I hope this information has been super, super helpful for you to understand really what's going on. We have the common thread of the nervous system. If the nervous system is stressed, that's going to cause the baby to be stressed, thus changing the way the digestive system works, thus resulting in symptoms like colic, constipation, and reflux. So instead of going the medication route to cover up the symptom, we want to know, has the baby been under stress, either physical stress, emotional stress, or chemical stress? And then if they have, bringing them to a pediatric and prenatal chiropractor like myself is the key to getting to the root cause. Now, if you're wondering what it might be like to bring your baby to a chiropractor, like I said, obviously it's very safe and very gentle. One of our diagnostics that we use to see if there is stress and to know how many adjustments or how many sessions we might need is we use infrared thermography, which measures inflammation from the low back all the way to the neck. And that gives me an idea of where the root cause in the spine might be, that poor movement in the spine might be. And that lets me know where the problem is, how bad the problem is, and thus how many adjustments we need to get the baby out of that stress cycle and into that relaxed cycle. Having a plan, having a teammate that knows this is what we should be seeing, this is what we should be doing, I know can provide all the peace that you need to make sure that your baby is continuing to grow and to develop, and for you to stay off that side of anxiety and depression and wondering if you're doing a bad job mothering, because it's not your fault. It's the baby is stressed, and if the baby is stressed, it's a good thing that they have those symptoms, because they're trying to let you know, Mom, I'm stressed. Please help me figure out what's going on the inside, and please help me take care of it. A couple really cool testimonials, which you can, one of them, I think it's on Yelp that you can find. His name's Baby Drew, came to me about 4 weeks old, crying 15 hours a day. And this was really, really stressful for the mom, obviously already having, a 3-year-old to take care of. And obviously when the dad came home, the mom was just strung out, just didn't have any energy, any patience, couldn't get anything done throughout the day. After his first adjustment, he started sleeping. That went away nearly completely after the first adjustment, where it wasn't crying 15 hours a day. Actually was, got down to crying at a pretty typical, when they get fussy or before bed. And so that was a huge life change. The second one, this baby came to me, had all 3 problems, was on Zantac for reflux, was on Miralax for constipation, and the doctor wanted to prescribe an antidepressant for the colic. We did his nervous system scan and found out that there was severe amounts of inflammation in multiple different points in his spine that was limiting communication to the brain, which is causing the baby to be in a severe state of stress. It was caused by mom had a stressful pregnancy, dealing with an older sibling that already was diagnosed with autism, as well as a traumatic birth process. The mom tried to give birth vaginally, the head got stuck. They used 4 different vacuums. There was 4 hematomas on the top of this baby's head, trying to get that baby out. They ended up doing an emergency C-section, where the mom was told we really had to pull this baby out of the canal. And that was a lot of stress right at the base of the neck, which causes that baby to be in a state of stress. If right at the base of your skull is stressed out, you better believe that the rest of the body is going to be stressed out as well. We did his first adjustment about 8 months old. The baby had a pretty significant detox process where we got the bowel movements moving, and the mom was like, this is like toxic poop. Like, this is not something that we should throw away in a regular garbage bin, because of how much medication, how much stress and toxins was built up in the system, because the baby wasn't ready to get rid of it, because it was in a state of stress. Was able to stop the Zantac, was able to never go on that antidepressant, because we help the body get into a state of ease and change the rest of this kid's life. They were going into a state of medical dependence for the rest of their life, and we took him out of that cycle and into a state of ease, into a state of proper growth and development. So if that's you, know that you're not alone. Know that there is help out there. If you're interested in getting a consultation, we'd love to book you. We offer special offers if you've watched this webinar because you're already ready to go. My number is 951-698-4848. You can call us, you can text us, you can contact me on Facebook or Instagram. We are here to help you, even if you just need to talk, even if you just need to reach out. Is this normal? Is this something that might help my baby? I'd love to do that consultation with you to see if we can help you out. More than likely we can. Thank you so much for watching, and I hope you have a great rest of your day.